Good morning, class. Last time we talked about the uses and functions of caregiving tools and equipment. Now, what we are going to study today is about the use of caregiving tools, equipment, and paraphernalia properly. Now that you have successfully identified the different tools, equipment, and paraphernalia in providing healthcare, it is a must that you master the proper utilization of each. As an efficient and dependable caregiver, you must learn the procedures in operating them, since you will be expected to use them in your particular job. If you are a caregiver, the caregiving tools and equipment are your partner. You cannot simply work on your own. That's why it is definitely a need to be familiar with caregiving tools and equipment to be able to provide the right care and the right tools and equipment. If you are familiar with the caregiving tools and equipment, you can contribute or you contribute to the well-being of the person you are caring and not the other way around because you are providing the needs of your patient. Okay? Now, we have common equipment used in meal preparation. What are those? We have stove, ladle, coffee maker, air pot, blender, food tongs, and so on and so forth. When using and maintaining tools and equipment, all you have to do and always remember is to remove the socket first so that it will not cause an accident. And if you clean it, make sure that you remove every part of it in order for you to clean it truly and properly. And if you will use it, no, um, make sure your tools and equipment are in the right place so that it will not cause a harm. And one thing more, also make sure that you place the food um, that you should place the food properly in whatever tools and equipment that you use in order to cook it fully and properly. And after using them, the tools and equipment, put it or keep it in the right place so you can easily find it when you need it again. Okay, always remember that, guys. Next, we have common equipment in cleaning, laundry, and ironing. The first one is flat iron. Number one, check the label of every garment before ironing. Why? It is necessary as some fabrics needs special care instruction because fabrics varies um, with texture, weight, fabric content. Okay. Number two, unfold your ironing board near the outlet. Plug in your iron and choose the appropriate setting based on the material that you are ironing. It is better if the ironing board is placed or is close to the outlet so that it is not difficult for someone to iron. Okay? Number 3. Preheating the flat iron should be done before starting. You will have to wait 2 to 5 minutes to let the iron warm up. Okay? Number 4, stretch the garment across the ironing board to make sure it is flat in order for you to iron it properly. Okay? Number 5, run the iron over one part of the garment such as the hem just to be sure that it is not too hot. We need to check or test the iron before we proceed in order to know if it is too hot or not. Okay? Next, move the iron over the pants, blouse, or shirt and take note of the pleats and pockets. For the shirt, start with the collar, then to the sleeve, and then the shirt itself. For the pants and short, start with the inside and then the outside of the pants, starting with the wristband down. Okay. Next, unplug the iron and allow the unit to cool before storing it in order to prevent the occurrence of burn, okay, or fire. Next, washing machine. The very first step in washing machine is sorting the clothes of your client. Separate white and light colored to dark colored clothes, and also they should be sorted according to their material. Okay, prevent in order to prevent the clothes from having stains. Okay, next, put detergent into the washing machine. Let the detergent go to the bottom of the washing machine. Syempre, para kumalat yung detergent. Next, put the clothes loosely into the washing machine in order for it to wash fully and properly. Okay, load the laundry as high the manufacturer specify or the top row of holes in the tub. Okay, and then close the lid. Isasara mo na yung takip niya and choose the setting that clothes according to the clothes that you are washing. Next, turn on the machine. Okay, let the unit work through all of the cycles and wait wait the machine before or wait the machine or never unload your laundry if it is not yet done. Okay, kasi hindi siya mawawashing totally. Okay, load the next batch of your clothes and then repeat the steps 4 and 5. Okay, and then turn off and unplug the unit, and that's it. You know how to use the washing machine properly. Okay, next, we have common equipment in taking the vital signs. When taking when caring for an infant, toddler, elderly, or person with special needs, measuring the vital signs is of utmost concern. This is also a concern of your client because he or she has the right to know her or his vital signs. Because vital signs is the bodily functions that reflect the body's state of health and are easily measurable. That these are the body temperature, pulse rate, respiratory rate, and blood pressure. In some cases, the fifth vital sign is considered to be the pain of the person that a person experiences. Okay, next. Thermometer. What's thermometer again? Thermometer is a device used to measure temperature. Body temperature is a measurement of the body, is the measurement of the amount of heat in the body. The balance between heat produced and heat loss is the body temperature. Always remember, the normal body temperature is 37 degrees Celsius. Okay, take a look at these normal ranges of body temperature. We have oral, sa bibig yan, sa rectal, sa puwet, sa axillary, sa kilikili. Okay, next, we have different types of thermometers. We have clinical thermometer. Clinical thermometer is made of glass with a narrowing above the bulb so that the mercury stays or so that the mercury column stays in position even when the instrument is removed. This type of thermometer, no, is now being eradicated as the mercury content is dangerous to people. Kaya wala na masyadong gumagamit nito kasi delikado siya. Okay? Next. Digital thermometer may be inserted into the mouth, under the tongue, under the armpit, or into the anus. This thermometer displays the reading in the LCD. Okay, this type of thermometer does not use mercury, which is hazardous to humans. That's why more and more people are using it now. And also using it is very simple, quick, and effective. Okay? Next, ear digital thermometer measures the heat coming from the eardrum. This release of heat is converted into a temperature and displayed on an LCD. This is very easy to use. Why? You just have to place the tip on a you just have to place the tip on a person on the ear of a person and then press the button, and in a few seconds you can see the measurement on the LCD. Okay? Next, infrared thermometer with laser pointer. Measures temperature using thermal radiation emitted by the body. It is also called laser thermometer if a laser is utilized to aid in aiming the thermometer. Infrared thermometer. Others call it non-contact thermometer. Why? Because of its ability to measure temperature from a distance. It provides temperature reading without physically touching the object. All you have to do is aim at the object, as in your forehead, and then pull the trigger, and immediately you can see the temperature reading on the LCD. Okay? Next. Okay, we have using a digital thermometer. Rectum through the anus. The first step, wash your hands and take the thermometer out of its holder in order to remove the dirt and bacteria in your hand. Of course. Number 2, clean the probe, the pointed end of the thermometer with rubbing alcohol or soap, and then rinse it in cool water to keep it clean before use it on the patient, of course. Put a probe cover over the pointed end of the thermometer in order to maintain its cleanliness and to prevent breakage. Okay, if your thermometer did not come with a probe cover, then you can use it without one. Okay, next, lubricate the end of the probe with a small amount of lubricating jelly so that you can easily insert it into the rectum. Okay, next, place your child on his stomach across a firm surface or your lap before taking his temperature in order to make him or her feel comfortable while taking his or her temperature. Okay, next, gently slide the probe in of the thermometer into the rectum about a half inch. Okay, in order to get your patient's thermometer. Stop inserting the thermometer if it becomes difficult to insert. Never force the thermometer into the rectum. When you forcefully insert the thermometer into its rectum, it can cause harm. Kaya wag nyo pipilitin. Okay? Continue to hold the thermometer the entire time you are taking the temperature. Okay, always stay with your client while taking the temperature in order to monitor it because there is a chance that it will not be accurate when not monitored. Okay, keep the thermometer in place until it beeps, then remove the thermometer. Okay, this is the time na when the thermometer beeps, it signifies that you can remove. Okay, next. Read the numbers on the LCD. These numbers are your client's temperature. Okay, um, write it down in order for you to have a record. Okay, if you use a probe cover, remove it and throw it away. It's no longer useful because it may already have dirt, so it needs to be discarded. Next, wash the probe of the thermometer with soap, water, and rubbing alcohol when you are done to remove dirt and bacteria. And then put the thermometer's tip cover, and then put the thermometer in its holder or container in order for you to find, find it easily. Okay, record the reading in order for you to have a record or a basis. Wash your hands, okay, to remove the dirt and bacteria. And that's it. Okay, next, using a digital thermometer. Sa mouth naman yan. Wash your hands and take the thermometer from its holder. To remove what? To remove dirt and bacteria. Clean the probe, the pointed end of the thermometer with rubbing alcohol or soap, and then rinse it in cool water to keep it clean before use it on the patient. Okay? Inform the client that you are going to take his temperature orally in order for him that like what I've said before, he or she has the right to know what procedures that you will do. Okay? Ask the client to wet his or her lips and pick up his tongue. Okay, this is the time you take his or her temperature. Place the thermometer under the client's tongue on one side of his or her mouth. Ask him or her to close his or her lips. Okay, you may have to hold the thermometer, especially if your client is sick or weak enough to even hold the thermometer. Okay, then leave the thermometer in place until the thermometer signals it is finished. When the thermometer beeps, it signifies that it can be removed. Okay, remove the thermometer carefully and read the temperature on the digital display and then write it down in order for you to have a record. Clean the tip of the thermometer with a cotton ball soaked in alcohol. Okay, and then put the thermometer's tip cover and then put the thermometer in its holder or container para madali mo siyang mahanap kapag kakailanganin mo siya. Okay, number 9. Record the reading in order for you to have a record and basis, and wash your hands in order for you to or in order to remove the dirt and bacteria. Okay, and that's it. Next, using a digital thermometer sa armpit. Wash your hands and take the thermometer from its holder. Ito yung lagi nating gagawin kapag nag-uumpisa tayo mag-take ng temperature in order to remove the bacteria and dirt. Clean the probe, the pointed end of the thermometer with rubbing alcohol or soap and then rinse it in cool water to keep it clean before use it on the patient. Inform the client that you are going to take his temperature under the arm, armpit so that he knows who you are. Okay, and like what I've said before, he or she has the right to know the procedures. What procedures will you do? Okay. Place the thermometer under the client's armpit. Okay, this is the time that you get your patient's temperature. Leave the thermometer in place until thermometer signals it it is finished. Okay? When the thermometer beeps, it signifies that it can be removed. Okay? Number 6. Remove the thermometer carefully and read the temperature on the digital display. And then write it down to have a record. Clean the tip of the thermometer with a cotton ball soaked in alcohol. Parang pareho lang din siya dun sa anus or sa rectum and sa mouth, di ba? In order to remove the dirt and bacteria. And then put the thermometer tip cover and then put the thermometer in its holder or container. And last one, record the reading for you to have a record and a basis, and wash your hands to remove the dirt and bacteria. Next, we have BP apparatus. Another important measurement that you should learn to take is the blood pressure. Blood pressure is the force of the blood pushing against the walls of the blood vessels. Okay, the heart contracts as it pumps the blood into the arteries. When the heart is contracting, the pressure is highest. This pressure is what we know as the systolic pressure. Systolic pressure is the pressure of the blood of when your heart beats to pump blood out. Okay, I will repeat. Systolic pressure is the pressure of the blood when your heart beats to pump out blood. Okay, now, as the heart relaxes between each contraction, the pressure decreases. When the heart is at its most relaxed state, the pressure is lowest, and we call this diastolic pressure. Diastolic pressure is the pressure of the blood when your heart rests between beats. Okay, I will repeat. Diastolic pressure is the pressure of the blood when your heart rests between beats. Okay, this reflects how strongly your arteries resisting blood flow. Okay, next. First one, wash your hands and prepare the equipment you will use so that it will not be difficult for you to take the patient's blood pressure. Number 2, in order or introduce yourself and let the patient client know the procedure to be done. Like what I've said before, he or she has the right to know what procedures will you do. Okay, number 3, sanitize the earpieces of the stethoscope with an antiseptic pad in order to prevent the contamination of microorganisms. Ask your client to rest quietly. Have him or her lie down or sit on a chair, whichever is more comfortable for him or for her. Number 5, if you are using a mercurial apparatus, the measuring scale should be within the eye level of your eyes in order for you to read it immediately and accurately. Okay. Expose the arm of your client by rolling the sleeves up. Okay. In order, okay, have your client's arm from the elbow down to rest fully extended on the bed or arm of the chair. Okay, nang sa ganun, maging komportable siya. And then, 7, unroll the cuff. Loosen the screw and squeeze the cuff with your hands to remove air completely. This is the time you will get the blood pressure of your patient. Okay, wrap the cuff and wrap the cuff around your client's arm above the elbow, not too tight or too loose. Okay, always remember not to be tight or not too loose in order to get the exact blood pressure of your client or patient. Next, find your client's brachial pulse at the inside of the elbow. Brachial pulse can be felt on the front side of the elbow dito. Okay, dito siya. Yun yung brachial pulse. Place the stethoscope's earpieces into your ears and place the diaphragm on the brachial pulse in order for you to feel it and hear the blood pressure sounds. Okay? Turn the screw to close it and then turn the screw to open it because it is a device for releasing air from the bladder. Okay, next. You have to continue releasing the air from the cuff. You have to continue releasing the air from the cuff in order for you to get the blood pressure of your patient. Okay, deflate the cuff. Remove it from the arm of your client, and then write the reading on the client's chart. Okay, next and last one. Wipe the earpieces of the stethoscope with an antiseptic pad and place the equipment back to their proper place and wash your hands so that it can be easily to find it when we need it again. Okay, and then wash your hands to remove bacteria or dirt. Okay, okay, that's all for today. Thank you for listening, guys, and I hope you learned something from our lesson. And that's it. See you next meeting.